and lupus. Getting better, you know. Yeah, and last night we had our live stream on YouTube, and we had a patient who had multiple sclerosis,
Right.
and we helped her to heal. Now they can't find no MS no more, so you know we're doing some good things, you know, with the help of the Most High. Yeah, yeah. So we want to talk because I had today's what, Thursday.
Yep.
Between Monday and today, we had 7 people come into my office with kidney stones. Could you believe that? In Grenada, right here.
Wow.
7 people. Yeah? And when you look at some of the stones, they're very big. Some of them are big stones. So we're trying to educate our people on how to take care of the kidney and prevent kidney stones. All right? Because the different type of stones, you know. There is cystine stones. And there is uric acid stones. And there is calcium crystal stones. So there are 3 different kinds of stones.
So people think when you have stones, it's just one particular kind of
No,
stone.
no, yeah, just that's how they think. But because the main stones is calcium crystals,
Yeah.
from calcium, but you have uric acid stones, and then you have cystine stones, and the cystine stones come from when you're not metabolizing B6 and L-cysteine properly, so you get cystine stones. All right, so that is what caused the cystine stones.
Oh, okay.
Right, but they are rare unless you're deficient in this vitamin and that particular amino acid. Uric acid stone is from proteins. Too much protein build up in the blood because of the liver, and automatically you start to get uric acid stones.
But how do you know which kind you have? How do you know?
Well, the doctors will determine that. That's why taking a test is important. The doctor will tell you, will make you understand which one is cystine and which one is uric. But mostly 80% of the stones is coming from
The crystals.
calcium crystals. Cheese is a culprit. Milk is a culprit. And I want to mention about milk this morning. Lots of people feel, you see all these television commercials about milk, and I want to come on your program for them to come and see We FM. It's me, Patrick Dell, saying it. Patrick Dell, not We FM. All right? It's not the radio station, it's me. Milk have calcium, but the calcium that milk have is not organic calcium. It's inorganic. Meaning that when they pasteurize the milk, the calcium that comes from the grass that the cow eat disappears with the vitamin D, because you need vitamin D for absorption of calcium, right? Now, once they pasteurize the milk, the calcium that is naturally found in the milk from the cow disappears. So what the dairy companies do is they inject a hormone, calcium, in the milk. The problem with that calcium is it is inorganic. You follow me?
Yeah.
So if it's inorganic, here's what it does. The first thing that the calcium from the milk causes is troubles in your heart. It causes plaque to form in the arterial walls. And that's the reason why when I come on your program, I have research. I have studies. I'm not coming and tell you and your audiences what Patrick Dell is saying. There are studies or there are research proving that calcium from the milk clogs the arteries. That's a fact. Number 2, the soldiers who died in the Korean War, 19 to 21-year-old soldiers, when they opened the chest for the autopsy, they found lots of calcium from milk in the walls. They were full of arterial blockage already at that particular age. And they used to drink a lot of milk.
Oh.
Even 3-year-old too, when they die, calcium plaque in the walls. That is one of the negatives of the calcium in the milk. That's number 2. That's number 1. Number 2, guess what it causes again? It causes kidney stones, right? Because once you start to drink lots of milk and it gets into the system, the parathyroid, which is surrounding your thyroid itself, they're supposed to do what? Metabolize calcium and the B complex. And that's why when you have an overactive thyroid gland, we work on your parathyroid, because you're not metabolizing calcium and the B complex well. So once calcium is inorganic and cannot be metabolized by the parathyroid, it becomes solid. Where? In the earth. Which is the earth again? Your digestive system. coming back in your kidney and mixed with oxalic acid and cause you to have kidney stones. You follow me? And that's why the doctors themselves will tell you, once you have kidney stones, do not drink milk and do not eat cheese. That's the first ban they put on you. But they tell you, drink cranberry juice. So when they come to me and say, you drinking cranberry juice? Yeah. I say, who told you to drink cranberry juice? My doctor says so. I said, well, the doctor is wrong. Because if calcium crystals mixed with oxalic acid gives you kidney stones, and you drinking cranberry juice, guess what have oxalic acid? Cranberry juice. See what I'm saying here? So you're putting fire in your fire. So I always teach my patients that the only time you drink cranberry juice is to do what? To prevent bacteria from adhering on your bladder walls. If you have kidney stones, leave cranberry juice alone. If you have cystitis, leave cranberry juice alone because it has oxalic acid. And once you have any kind of trouble in the bladder, you don't use sugars. And a lot of the cranberry juice, they have 27 grams of sugar in the first place. Waste of time. See? So that is the main cause of kidney stones. Now, I want to mention to people now. If you go to your doctor and the doctor sends you to get an ultrasound of the kidney and they pick up stone in your kidney, do not go to any herbalist if the kidney stones is too big. Because if the stones are too big, they would not come through your pole and you're going to get pain. They can also be small and give you pain too because they have things like fingernails. So when they come down, they start jagging your tissue, so you feel that little jerk in your back. Now, if the stones are in the upper pole, you get pain in the upper back. If the stones are in the lower pole, in the middle pole, you get pain in the middle of the back. If the stones is in the lower pole, you get pain in the lower back, but the pain comes around your waist.
Right, and you feel that on one side.
Yes, that's a symptom of it.
Okay.
If you have kidney stones. Now, when you got kidney stones now, as I said, when the stones is too big, you don't go to a herbalist. And the problem we have in Grenada is we do not blast the stones out. We don't do that. So people have to go to Trinidad. If the stones are small, we can move them out with herbs. Let me give you the name of the herbs now. The first herb is called gravel root, Gravel. Gravel root. When you have kidney stones, you must use that. When you have kidney stones, you must use another herb called stone root, STONEROOT. You must use them because they crush the stones up. Not if the stones is too big. When you have kidney stones, you must use diuretics or you must use antiseptic plants to the bladder. Corn silk, or we call it corn beard in Grenada. Another herb, again, we use it, another herb called Uvarasi. What these herbs do, while the gravel root and the stone root is crushing the stones, these herbs are helping the stones to be removed via the urine, pushing them out of the bladder walls. Yeah?
Yeah.
Now, so we use diuretics, we use antiseptics, and we use the stone crushers. Now, once you have kidney stones, remember that the stones, although they are small, and they're coming to the pole, they have things like fingernails, they could always jerk you and cause you to have pain. So what we do, we give you a 1/4 cup of olive oil and a 1/4 cup of lemon juice. And we mix them together. And we make you take a teaspoon every hour from 1 p.m. to 6 p.m. for 4 days. And the purpose of that is to lubricate the pole so when the stone's coming down, they don't give you that pain. Because you know oil is a lubricator. You know, I mean, when you're going to have virgin, you know, the virgin thing, I think you use the Vaseline. So, you know, you must use the oil for the stones. So that's what we get rid of stones. Now, people who have kidney stones, the stone could come back. Because you can make anything that you had before, a disease, come back to you. If you go back to the same way of eating. See? So my advice to my patients is, once you had kidney stones, try to avoid going back eating cheese, number one, and try to use magnesium. Don't forget the mineral now. You see that mineral? lots of people is lacking in that particular mineral, Mikey, magnesium. They're lacking in that. 80% of the American public is lacking in magnesium. And that's why lots of women get period pain. Period pain is because of lacking of magnesium, because it works on muscle and it works on the nerves. See, it is a relaxer. So what the magnesium do, once calcium come into the body, magnesium calls it as a traffic cop. And if there is not enough magnesium to call calcium, calcium gets stuck in your soft tissues and cause you to have not only troubles in your heart, but cause you to get kidney stones also. So once you have kidney stones, you must implement a mineral called calcium, magnesium in your diet. 1,000 milligrams per day will guide the calcium out so that the stones don't come back. That's the key. All right? That's how we fix kidney stones.
But before you do that, you have to understand what your calcium levels are before taking that.
Good question. I say I like it. That's good questions. I'm a toes. I'm thinking. If there is organic calcium, if there is excess, I'm going to use the word organic loosely. If there is an excessive amount of calcium and it is organic, it moves out naturally because it's water soluble. Just like vitamin C. Vitamin C is a water soluble vitamin. So that's why you gotta take it during the day, space it out. You can't just take 5,000 milligrams of vitamin C per day. You're crazy. Because you pee it out in the urine. So you take 1,000, 1,000, 1,000, 1,000. You know, or 2,000, 2,000, and 1,000 per day. Because it's water soluble vitamin. Be completely the same thing to the all water soluble. So if there is an excess and it is organic, like sodium is, it will move out. See? So your calcium, because the body is wise, the body knows to get rid of certain things. So the body will keep that level normal if the mineral is organic. But when you have inorganic calcium in your body, now you start to store them now because they can't move because they're inorganic. See what I'm saying to you?
Yeah.
And that's where the plaque in the walls come from. That's where your heart troubles come from. That's where your high blood pressure come from. That's where your kidney stones come from. Because inorganic calcium is not good for you. You see what I'm saying to you? Just like sodium. Lots of people go to the store, they buy the table salt. That's inorganic sodium because they polish that. Sodium chloride. See? And inorganic sodium, in Chinese medicine, we say that salt goes down and in, and sugar goes up and out. So once you have too much salt in your diet, and it's not organic sodium, you start to get what? Troubles in your joints. You start to get arthritis. You start to get troubles in your veins. You start to get varicose veins because it's not organic. You see what I'm saying to you?
Yeah.
But when you use the sea salt, that is natural and is organic, the excessive will move out of the body. Unless you're not metabolizing sodium and phosphorus well, then you will try to start to have trouble in your kidney long term. So that's how we get rid of calcium. So inorganic calcium don't move. Organic calcium moves. So you can take a test and your calcium reading is supposed to be around 9.5, 10.0. That's where it's supposed to be. If it's over that, you have too much calcium. But if you're over that because you have too much inorganic calcium in your body. That's the bottom line. So always take a calcium supplement in the liquid form from food base, from minerals or nuts and seeds, because calcium in the tablets don't work. So people pop calcium in the tablet. Oh, I'm taking calcium from my bones.
It doesn't work.
It don't. Not in the tablet form anyway. And that's why people have so much arthritis. It don't work. Because remember, you know a lot of older people, they see the teeth are shake, they lose the teeth. Why do they lose the teeth? Because they are deficient in calcium. It's not found in the bones. Because the body is so acidic that when the body is in an acid state, the body pulls calcium out of the bones to buffer the acid, to prevent the acid from going into your arterial walls. So you must have organic calcium, and you must have the body in an alkaline state in order for you not to lose calcium and have trouble in your bones and have trouble in your teeth. Bottom line. People have to be educated about these things. So calcium in the tablets, don't even buy it. It's a waste of time. It don't do nothing for you. It sticks in the system. But organic calcium in the liquid form, in the powder form, is much better because it's organic. It moves faster. And you have to know what calcium carbonate, calcium citrate, calcium this, calcitrate, all of them is instead of garbage outside there. So people have to know what they're buying. That's number one. Number two, let's talk a little bit about PCOS, polycystic ovarian syndrome, which affects a lot of young ladies today. And lots of doctors go to where? To insulin resistance by giving the patient or the young lady or the woman a pill called metformin.
Yeah.
That's what they give them. And metformin is a drug they give for diabetics. They give to diabetics who have diabetes. But the doctors who treat a woman for PCOS, that's why we go to Dr. Sebastian Peters when we leave here. We're going straight to Dr. Sebastian Peters across the street. He's the doctor of the endocrine system. We're going to do a live video with him on my channel, on my Facebook page in about half an hour. You understand? And that's he's trained in that area. So he's going to give you more information about the gland in your brain that cause you to get PCOS as a woman. In half an hour, go to my page, Patrick Delps, on Facebook, and you're going to see me and Dr. Sebastian Peters there. Right now, when a woman have PCOS and she come to me,
you can break it down again in terms of
polycystic ovarian syndrome. Right, a lot of follicles on the ovaries.
Yeah.
Now, if there are follicles on the ovaries, or a woman have what we call an ovarian cyst, she either have a dermoid cyst or she have a functional cyst. It's two of them, you know. One is functional, one is dermoid. The functional cyst goes away after a next period when the woman is ovulating. Yeah? The dermoid cysts don't move. And that's why doctors say, we have to remove them surgically. Yeah? Now, when a woman is getting these conditions in her reproductive system, is because her diet is inadequate. She's not balanced. So she started having troubles in the ovaries. She either have ovarian cyst, PCOS, or she started having what we call an enlarged ovary. You understand? An enlarged ovary. And she get what we call ovarian pain. Pain in the ovaries. Either the right ovary or the left ovary. Now, let me teach you women what you have to do to avoid yourselves from coming down with PCOS and ovarian cysts. Now, in the body have lots of glands. And we call it the endocrine system. And all your glands in your body, the whole 8 or 9 of them, they have a function. And they work together like the organs do. See? And they work in sync. You understand? So for instance, if you have trouble in the thyroid gland, it don't have to come from the thyroid. The cause of your goiter, or the cause of your overactive thyroid gland, or the cause of your hypoactive thyroid don't have to come from the thyroid gland. It could come from the pituitary gland, come from the thymus gland. It could come from the hypothalamus gland, because they all work together. So all the glands are based on the endocrine system, which lots of doctors do not know about. And every day there is new information coming out on the endocrine system. And that is what we're going to learn from that doctor today in about half an hour. See? Now the gland in your brain, called the pituitary gland, that gland is very significant in a woman's ovarian health, in her ovaries. Why? Because that particular gland depends on the hypothalamus gland for good function. I want you to follow me now. And the gland have two parts. I think it's the posterior part and the middle part of the gland. They do different things. Now, one part of the pituitary gland controls what? It controls the adrenals. Another part of the pituitary gland controls the pancreas. Another part of the pituitary gland controls the kidney for your water balance. And another part of the pituitary gland controls the thyroid gland and also control a woman's ovaries. Hear me, Mikey?
Yes, sir.
So, if the pituitary gland do not receive a signal from the hypothalamus gland, that pituitary gland can never ever normalize a woman's luteinizing hormone and a woman's follicle stimulating hormone. If these both is not regulated or balanced, a woman's progesterone and a woman's estrogen will never be balanced, and she will get growths in the uterus or in the ovaries, and then automatically, because her pituitary gland is not normalizing both luteinizing hormone and follicle stimulating hormone, a woman will start to produce androgens. Androgens mean men hormones, because the pituitary gland is imbalanced. And once a woman starts to produce androgens, men hormones, she starts to get hair on her legs, she starts to get beard like us, she starts to get mustache, she got to shave, because the endocrine system is imbalanced. And that's the reason why women get PCOS. So what they do, they give them a drug called metformin, and not knowing that that particular condition is caused by the whole endocrine system. You see what I'm saying to you, Mikey?
Yeah.
It's not just by insulin resistance. So you have to go back to the endocrine system, all the glands, and you have to feed them plants. Let me name you a few of them. The first one is called CHASTETRW, chaste tree. Now, that particular problem in women, PCOS that is, once a woman can implement that particular herb in her diet, that particular herb called chaste tree goes into the brain and normalize the function of the pituitary gland. And while it is normalizing the function of a woman's pituitary gland in the brain, that pituitary gland now starts to normalize a woman's luteinizing hormone and her follicle stimulating hormone, which in turn cause both her estrogen and her progesterone to stay balanced, and all of a sudden, in about 3 to 6 months, that woman PCOS disappears. Plus, when I'm treating PCOS, I go to the lymphatic system, because the lymphatic system is interesting too. It is part of the immune system, but it is where you house your macrophages, and it is vessels and fluids flowing parallel to the blood. So we have to go to the endocrine system, which is the glands, but we also have to go to the lymphatic system to cause the fluids to flow thin and cause your immune system to function well, and then automatically we fix PCOS. Here the herb to use there: burdock, cleavers, red root, echinacea, red clover, blue violet, pork root. And once you put these herbs together, 1 teaspoon to a cup of hot water, you cover it for 5 minutes, you strain and drink 3 cups per day, you will cause your lymph fluids to flow so thin. And while we're working on your glands in your brain, the endocrine system, you will have your reproductive system removing toxins and growths from that area. So we use chaste tree, we use saw palmetto, we use another herb called cypress root, we use another herb called shepherd's purse in case there is bleeding in the woman's vagina, we use another herb called white peony, we use another herb called red clover in case there's a growth, because red clover have shrinking abilities, have anti-tumor activity. We use another herb called podiaco. We use another herb called mother's water, another herb called dankwi, and the purpose of dankwi is to help the liver to remove the excessive amount of estrogen a woman seems to keep in the body that cause all these growths in her reproductive system. But it shrinks things and it moves the blood. So a woman don't get what? Period pain. A woman don't get what? Growths. A woman don't get what? Kidney, ovarian problems. And if there is ovarian pain, and the woman having pain from that particular ovary, we give her what? Black haw. We give her cranberry. Because black haw and cranberry are two plants that we use, and wild yam, they're what we call antispasmodic plants. They prevent spasm of the uterus. See what I'm saying to you, brethren? Or blue cohosh. They're for ovarian pain. Not a painkiller. I mean, not an ibuprofen. You know what I mean? You fix the troubles. So once a woman has PCOS, she must learn to go into the endocrine system and balance them back. And it's part of the pituitary gland, the hypothalamus gland, the thyroid gland, the adrenals, the parathyroid, the ovaries, the pancreas, the prostate gland. They are all part of the endocrine system. And in order for you to take care of them properly, you must use herbs, because each one of those glands have a herb that works for them. See what I'm saying there, brethren?
Yes, sir.
Life is not so complicated, you know, Mikey. People make it complicated because of the way we live. You know what I mean? And then again, when the babies are in the mother's womb and they give them injection, and they give the woman, don't learn it from me today, they give the woman injection, they cause the child, if it's a girl child, to have troubles in the ovaries long term. Them injection they give them when you're all pregnant, especially women who's suffering from preeclampsia and eclampsia. When they give you all injections, it affects your fetus, and automatically it makes your children come out to be what? Like, for your friend, for example, you say, you know what that means? Huh? I know if it's a girl, if it's a boy. I'm confused. Okay. I don't know if I'm a lesbian or if I'm a homosexual. You ain't born like that because of the injections. Do the research. Don't say Patrick Delsey. The research is there. The injection they give to women when they're pregnant.
All injections that they give, a specific injection?
All of them, they give them. Do the research. I'm going to give you the research. It causes women to have babies coming up with either men, little boys, little breasts, or they have women having troubles in the endocrine system long term. And that's why you have so many young ladies in the teens, man, coming to me with enlarged ovary, big cysts on the ovaries. And we have to shrink them. You know what I mean? Because the eating habits are bad. Eating food that have a lot of hormones. Eating food that have lots of antibiotics. Eating food, drinking water from the pipe that have chlorine. Toothpaste that have fluoride. NutraSweet that have aspartame. MSG in the seasoning. All these are conditions. All these are chemicals that is causing our children to have these conditions. And then they come and tell us, remove your uterus, remove your ovaries. You have children already, you could take it out. Because that's what they know. We tell you that God put plants on the earth for every disease that you have. Every single disease that you have, there's a herb for that. Every one you have. Unless you're chronic. Difficult to fix it when you become chronic. So you have to prevent it from happening. And if you do have it and it's not chronic, you can go back to nature, because nature have all the cures. All the cures are found in where? Nature. Woo! Blessed love.
All right. Thank you very much. That's Patrick Dells. And we would have another program we endeavor to, if you're still in Grenada.
Next week, Thursday, going to be the last program because I'm leaving on Saturday.
Okay.
And if you're in New York, don't forget, we just get him on a shanty call. The Stoner Man booked up, but still call and make an appointment. I'm booked up from the 22nd to the 2nd of June. But you can call the store. It's 718-469-0985. And you could call and talk to Trisha or Ashante. And you can make an appointment. And I'll try to squeeze you in as much as I can. Give God the glory every single day, because He is the ultimate healer of all things. Yeah? Bless the love, Mikey.
Thank you very much, sir.
Wonderful, man.
All right, folks. Patrick Dells, Mr. Worldwide. We've got 3 minutes after 11 o'clock, and we take a break. We got a lot more. This is WeFM Radio.
SB's Auto Show and Exhibition turns 5. Get in Gear 5. June
Remember causing that photo charge slow because the screen stayed on.
Yeah, I understand that. That must happen that way. Just a love, eh?
Right.
If thanks, Mikey.
Yeah. Later, guys, we're gonna come back with another program next week. God bless you.